Okay, good morning, or I should say good afternoon, everybody. Thank you so much for taking time out of your day to join us on this webinar. My name is Latrice Preston. I am the strategic business partner for iCuba. And today for our webinar, we are welcoming Rosie Marrero with Delta Dental. She's going to run through all of the wonderful benefits that are provided to you all through the Delta Dental programs that you have available to you. So just a little housekeeping as Rosie is going through her presentation, she will have stopping points where she will be allowing room for questions throughout her presentation. Feel free to raise your hand in the raise hand feature. We will call on you, and that way you will have an opportunity to ask her a question if needed. So with that being said, we are going to go ahead and get started with this presentation. Welcome so much, Rosie. We're glad to have you.
Thank you so much, Latrice. Very happy to be here and very excited to see that we have a good crowd joining us this afternoon to talk about dental benefits. So my name again is Rosie Marrero with Delta Dental, and I thank you for joining us this afternoon to discuss your dental benefits. And I will go ahead and get started. I will, as Latrice said, stop along the way for any questions. But I wanted to start with looking at dental health and overall health and the vital connection. With this visual, it really showcases all the ways that our oral health can affect our overall health. Poor gum health and tooth loss can increase your risk for a variety of chronic conditions and health issues, including those shown here. Gum disease is associated with an increased risk of preterm birth, as well as low birth weight and other pregnancy complications. Oral health can even affect your mental health. Oral health issues such as untreated cavities and tooth loss may result in serious mental health issues, including depression, social anxiety, and low self-esteem. So really just a reminder that dental health is healthcare. It is very related to your overall health, and it is very important that we maintain our oral health. So a reminder that if you haven't been to the dentist yet this year, incredibly, we are already halfway through the year. So I encourage you for yourself, for your dependents, for your children, if you haven't been to the dentist yet, definitely encourage you to get your dental visits in. We're going to review the two plans that are available, the PPO plan and the Delta Care plan. And again, as I go through the presentation, I will stop for questions. Wanted to start with a comparison of the two. This is a question that we get very often. Well, what's the difference between the two plans? And they're very different plans. They work very differently. But here are some general differences that are the general major differences between the PPO and the Delta Care plans. So on the PPO plans, you can visit any dentist that you want, whether they are in our network or do not participate in our network. We do strongly encourage you, though, to stay within the network because that's how you're going to save money. But if you want to go out of network, you can on the PPO plan. There are deductibles, there are maximums per plan year. And then depending on the procedures you're having done, you're gonna cover a percentage and the plan will cover a percentage. And then with the PPO plans, we do offer a base plan and a buy-up plan. Again, Delta Care plan works very differently. You do have to select your primary care dentist from the Delta Care network. There is no out-of-network benefits with the Delta Care plan. A referral is required for specialty care. The plan has copays associated with each covered procedure, so there are no deductibles or maximums. Just depending on the procedures that you're having done, you would pay the copay. And then with the Delta Care plan, which is the HMO type plan, there is one plan option. So we're going to go ahead and start with the PPO options. So the first thing that I want to remind you is that it is very important to stay within the network. We have contracts with our in-network providers and we have agreed upon fees. And so when you stay in network, you will definitely save on your out-of-pocket costs. When you visit a non-contracted provider, we have no control over what they're going to charge you. So really, they can charge you any amount. We encourage you to start with the Delta Dental PPO network. That's where you're going to have the greatest savings in your out-of-pocket cost. and also where the plan is going to save the most. But your out-of-pocket costs will be saved the most with the Delta Dental PPO network. The next best option is the Delta Dental Premier option. And if this is a case where you already have a provider you've been visiting for a long time and they happen to fall into the Premier network, that's great. You're still going to get a discount with the Premier network. It just won't be as much as with the PPO. And your plan works a little bit differently. So the percentages that are covered are different with the Premier network. But again, if it's a dentist that you've been with for a long time and you're comfortable with, you're still in a good place with the Premier network. Again, where we want you to try to stay away from is non-contracted providers. You will not save any out-of-pocket cost with the Delta with non-contracted providers. And so we strongly encourage you to try to stay within our networks. To find the providers that are in the network, you can go to deltadentalins.com. And if you already have created an account, the system will know your address that we have on file or that is on file with us. And so it's going to give you providers close to your address. And then from there, you can filter in various different ways. It's going to show you the map. You can look for different specialists, etc., on our website. If you're just visiting the website, meaning you haven't created an account, you can still find a dentist. You don't have to create an account to find the dentist. You'll just have to give it more information because it won't know your address. And again, the website is deltadentalins.com. So looking at the plans for the PPO, wanted to review the definition of maximums and deductibles. So your plan year maximum is the total amount that the plan is going to cover for you for your plan year. The deductible is the amount that you're going to pay before the plan starts paying. And then the lifetime orthodontic maximum is the most that the plan is going to pay for orthodontic coverage. Now, the plan year maximum refreshes each April, whereas the lifetime orthodontic maximum is once per lifetime. It does not refresh each plan year. Starting with the base PPO plan, you will see here the plan maximums. The deductible, depending on whether you stay in the PPO network, is $75. If you go to Premier, it's $100. And then out of network, meaning non-contracted providers, is also $100. For the family, the deductible is going to be within the PPO network, $225. And then with Premier or non-contracted, it'll be $300. Now, the deductible is once per plan year. So once you've met that, you don't have to pay that again. For example, if you had a crown done and you paid your $75 within the PPO network, you have no more deductible within the PPO network until the following plan year. The first 3 people in your family will meet that deductible. If you have more than 3 people on your plan, anyone beyond the 3rd person would not have any deductible. And then listed here are the percentages that you will pay depending on the services you're having done. A couple of things to point out here is that the deductible does not apply to your preventative services. So if, for example, you're having a cleaning, x-rays, things of that nature, anything that falls within preventative services, the deductible does not apply to those services. Okay. On the base plan, the orthodontics is going to be covered for children only. There is no adult coverage of orthodontics on the base plan. And again, the lifetime maximum for orthodontics is $1,500. And then the plan year maximum is also $1,500. So it's 2 separate maximums. The BIA plan works very similarly with different numbers. So the plan year maximum on the BIA plan is going to be $2,000. Again, the deductible is not going to apply to your preventative services. And in this case, the deductible for the individual is $50 up to $150 for the family if you're staying in the PPO network. If you're going to a Premier provider or a non-contracted provider, it's also going to be $50 up to $150. So on the BIA plan, it's going to be the same regardless of the provider that you visit. Now, on the BIA plan, there is coverage for orthodontics for adults and children. And the lifetime maximum is $2,000. So if you wanted to get braces for yourself or maybe for your spouse, that would fall under adult coverage. So if you're looking for that, then the BIA plan is the one that you should consider under the PPOs. Now, another question that I get often is, well, how do I know, what it's going to cost me when I go to the dentist? So we do have a tool that you can use online. It's called the Cost Estimator tool. And for the use of the Cost Estimator tool, you will have to create an account, and you will be able to log in. The tool will know your benefits. So they will know if you've met your deductible for the year, how much of your annual maximum you have left. So it's going to give you a pretty accurate estimate of what your out-of-pocket cost is going to be. With the tool, you're going to put in the information of the procedure you're having done, and then it'll give you the estimate. Another great thing about this tool is that if you have in the past used a non-contracted provider, it's also going to give you some examples of what your cost would be if you went to a PPO provider, so that you can see the difference of staying within our PPO network versus going out of network. Are there any questions on the PPO plans before I move forward?
And again, for those who have joined us a little later than our housekeeping, if you have a question at these points of break, feel free to use the raise your hand feature and we will address your question. So with that being said, I do have a question for Colleen.
Hi, I was trying to take notes, but I have a question about the adult orthodontia.
Sure.
I think that you said like braces would be covered with the buy-up plan. What,
Correct.
and then what was is it the $2,000 is the maximum that we're covered, or is that the out-of-pocket for adult braces? What?
That's a great question. So the benefit for orthodontics is it's covered 50% on the buy-up plan, up to $2,000. So $2,000 is the most that the plan is going to cover for you.
Okay.
I would
Thank you.
encourage you, especially with something like braces, I would encourage you to stay within the network. Your $2,000 will go much further with a PPO provider than with a non-contracted provider.
Oh, okay. Thank you.
So that's an important note to make.
Thank you.
You're welcome. Any other questions, Latrice?
I do not see any additional hands raised.
Okay.
Thank you.
You're welcome. So I'm going to move on to the Delta Care plan. And by the way, we should also have some time at the end for any questions that may come up as you're thinking about it. Moving on to the Delta Care plan. So the Delta Care plan is the HMO type plan that is offered. With the Delta Care plan, again, it works very differently than the PPO plan. With the Delta Care plan, you will select a provider that's going to be your primary dentist, your general dentist that you're going to go to for all of your work, and all of your work should start with your general dentist. With the Delta Care plan, there is no out-of-network coverage, so all of your work must be completed within the network of the Delta Care providers. With the Delta Care plan, there are no percentages. Everything is based on set copays. So depending on the service that you're having done, there is a copay. There are no maximums or deductibles on the Delta Care plan. Again, it's all based on the copays depending on the procedures you're having done. Pediatric care is available for dependents through age 13. And important to note that the Delta Care plan is available in approved states. So it's not approved in every single state, although it is available in many states, but not all states. For emergency or specialty care under the Delta Care plan, any specialty care that you're going to have done does require a referral from your general dentist to see the specialist, and they will coordinate that with you. They know who the specialists are within the network, so they'll refer you to a specialist within the network. And then if you happen to be traveling outside of your coverage area and you have an emergency, you can call the toll-free number and they will be able to give you an authorization to see any provider that you can get into for emergency care, meaning pain relief. So someone that can assist you, a dentist that can assist you with pain relief until you're able to get back to your designated area of coverage. So with the Delta Care plan, just wanted to give you an example of how it works, because it sometimes members say that it is a little bit confusing for them. So important to remember that you do have to select your primary care dentist. So you have to tell us who you want to see. You make your appointment, you visit your dentist, and then your responsibility is going to be any copays that are due. Again, there are various procedures that have no copay associated with them, but depending on which ones you're having done is the copay that you're going to be responsible for. If you're already on this plan and you have a dentist and you're thinking that you want to change the dentist for whatever reason, you can do that at any time throughout the year. You don't have to wait for open enrollment to change the dentist that you're visiting. You can call the toll-free number to change your provider, or you can also log in to our website and change your provider there. So it's very simple to do. You can do it online or call us to let us know who you want to change to. And then the list of all of the procedures that are covered along with the copays associated are in your benefits site. So you can go there. It was too long to list here, but the full list of all procedures that are covered are available for you there. And again, the booklet is going to include all covered procedures. So if there's a procedure that is not listed in the booklet, it's because it's not a covered procedure. Every procedure that you're having done, you can look in the booklet to see if it's covered and to see what your out-of-pocket copay is. And I encourage you, if you are on this plan, that you keep a copy of the booklet either on your computer somewhere or print it out. And when they give you your statement, make sure that they're charging you correctly, because, you know, the dental office could make a mistake. We have various different plans, so if they're looking at the wrong plan, they may be charging you incorrectly. I do encourage you to verify what you're being charged to make sure that you're being charged correctly. Any questions on the Delta Care plan?
I did have one question that says, are x-rays covered?
On the Delta Care plan and on the PPO plan, x-rays are covered. There are many different codes for x-rays, so I encourage you to look in the booklet if you're referring to the Delta Care plan to see the procedure code and to confirm that the x-ray that you're referring to is covered. But yes, x-rays generally speaking are covered.
Okay, and does the base PPO cover night guards?
No, night guards are not a covered benefit under the plans.
Okay, and I do see TJ is unmuted. Did you have a question?
Yes.
Okay.
And for some reason, chat is disabled on mine. I'm not sure why.
Okay.
The reason why I'm asking is the the emergency service that can occur in other states. Is that also good for PPO plan?
So the PPO plan is a national plan. So anywhere that you're in within the US, you'll be able to find a provider in the network. And you can just visit that provider. Again, you also have the ability to visit non-contracted providers with the PPO plan. So you can do that as well.
Okay.
So that's why it works a little differently on the Delta Care plan, because there's no out-of-network coverage. You have to call in for the authorization. You do not need to do that on the PPO plan.
Thank you very much.
You're welcome.
Rosie, are
Yes.
there any exceptions to the night guard? I'm getting a memo that we did ought to cover the night guards like a season ago. Is there anyone to follow up on that one?
Yes, I was actually looking because I thought I remembered that too. That is something that is normally not covered, but give me just a second to confirm that, because I was looking at the plan document as I was saying that.
It's normally not covered, Rosie, but we had added it to the
Yes.
plan.
Correct. So yes, on the PPO plans, the night guard are covered. Thank you, Renania, for correcting me there. I was kind of looking as I was saying that to confirm. So yes, to answer the question on night guards are covered on the PPO plan.
Hi, Rosie.
Okay.
I have two questions right here in the chat. This is Louis with iCuba. First question is, are implants covered under any of the plans and for how much?
So currently implants, let me just double check. I don't believe they are covered on any of the plans. Let me go back to the. Well, it doesn't specify here. Give me just a second. I have the plan document open, so I'll verify for you.
Yeah, I want to say perhaps in the Delta Care based on the copay, but I'm going to let you confirm.
It's definitely under the DHMO plan.
The Delta Care, right? Yeah.
Yeah.
I think it is under the copay structure from what I can remember.
Give me just a second.
Sure.
Yeah, so the Delta Care plan does cover implants. And let me confirm. I don't believe that the PPO does, but let me just look at it real quick here. I'm having a hard time just moving it over. I don't know why. Give me just a sec. Sorry about that. Yeah, I'm not showing that implants are covered. Latrice, Renania, if you have anything different, let me know, but I'm not showing that implants are covered on the PPO.
Yeah. Do you mind checking under the Delta Care?
No, Delta Care is.
Okay, perfect.
Yeah,
All right.
Delta Care does have it.
Thank you, Rosie.
Yeah,
The
you're
other
welcome.
question is, are Botox injections covered under any of the plans?
No, that one I can tell you definitely are not covered under the plans.
Awesome. Thank you, Rosie.
Yeah, you're welcome.
Okay, I'm not a little backed up on the question. So one says that our dentist will not allow my husband to have his basic cleaning that is included in the plan. They are requiring a different cleaning. Can they do that?
Yeah, so the dental office, it's kind of like telling the doctor that, you can't do this procedure, you can only do that procedure. That's really not something that we necessarily get involved in. I mean, they're the dentist, so we can't tell, the doctor what is right or wrong. I'm not sure what plan that person is on that they asked the question, but I would encourage them to maybe get a second opinion. If they're on the PPO plan, they can always get a second opinion with another dentist to see if the other dentist is giving them the same information. But again, we would not tell the dentist what is the proper procedure. They're the doctor.
Okay. So what percent would be the copay with the base PPO for the night guard?
It would fall under major services. So let's go back to the under the BIA plan, major services are covered if you stay within the PPO network at 50%
Oh, no, she said the base.
on the base. So major services, you would cover 70% after the deductible if you stay within the PPO network, or 80% after the deductible if you're in the Premier or non-contracted.
Okay. And then for an employee on the PPO plan, what happens if they need multiple root canals and you hit the cap with the plan max? Does that mean you have to pay the full cost for anything over the max?
So that's a great question. If you reach the annual max, the plan is not going to pay anything else. So you are out of pocket for the rest. However, if you're visiting a PPO provider, you will still have the advantage of the reduced PPO fee. If you're visiting a Premier provider, you will still have the benefit of the reduced Premier fee. Again, the PPO fee is going to be lower than the Premier fee, so that's going to be less out of pocket. But you will still have the benefit of getting the reduced fee, although the plan will not be covering any more of the procedures. Does that make sense? Does that answer the question?
Let's see if she responds. I don't see a response, but if I get a follow-up, I will let you know.
Okay.
What can we use as the guide to make sure we're being charged correctly? I think she's referring to the
On
plan.
the here, yeah. So that should be, I'm not sure, what is your intranet site called, Latrice, where like the benefits information is located?
Oh, and the B Swift portal,
There should be a copy there
in the benefits portal.
of the benefits pack of the booklet, and that's what you can reference to make sure you're being charged correctly. When you visit the dentist, they should give you a copy of your treatment plan showing the dental code for each procedure you're having done, and it should give you the amount that you're responsible for out of pocket, and that amount should match what's in the booklet. If for whatever reason it does not match, you can call customer service and they can assist you.
And I will send you, I have your information, so I can send you that plan doc and where you can find it directly, okay?
Reporting out there a long time.
Say again? Okay. Alrighty. Okay. This one says, I work in the College of Dental Medicine building in a private practice, which is a faculty practice. I just wanted our employees to know that here in the college, we only accept base plan and buy-up PPO plans, no HMOs. And a lot of our patients, employees, and patients are employees, and they sometimes sign up for the HMO plans, which we do not accept. So that was simply an FYI. Thank you very much. With the
Thank you.
buy-up, with the buy-up plan, retainers aren't covered with orthodontia. Would the out-of-pocket costs be considered in the total of lifetime out-of-pocket?
Is this a separate question?
Yes.
Okay, so read it to me one more time. The question
With-
is
With the buy-up plan,
Huh?
retainers aren't covered with orthodontia. Would the out-of-pocket costs be considered in the total of lifetime out-of-pocket?
So the retainer is covered within the treatment plan. The traditional or normal treatment plan includes a retainer for the orthodontics. If you lose the retainer or break the retainer, that's separate, it's different. But when you have the traditional 24 months orthodontic treatment, the retainer is considered part of the overall cost of the treatment plan. Does that answer the question?
It should. I'll see if they readdress it. Next question. On the buy-up plan, there is coverage usually 50% for implants. I'm not sure if that's a question or not. And there is coverage usually 50% for implants. So they're making a statement. They're saying on the buy-up plan, there is coverage usually 50% for implants.
Hey, Rosie, just to help you a little bit there. This is Lewis with IQBA. I was looking at the coverage details, and there's actually some language about prosthodontics where it does say bridges, dentures, and implants are covered at a 50% if you go through the the dental PPO. Is that something that you can confirm on your end?
Yes, I will confirm as we're on the call. Give me just a sec.
Sure, thank you. And just to confirm, that will be just for the buy-up, not the base.
Yeah, I just looked in the base and I don't see it on the base.
Yeah, it's under the buy-up only from what I can see right here.
Okay, yes, you're correct. My apologies. It is covered under the buy-up plan, not
Thank you,
under the
Rosie.
base plan. Sorry about that. Yes, you're correct. Under the buy-up plan, there is implant coverage. So of the 3 plans, the only one that does not cover implants is the base PPO. The buy-up PPO and the Delta Care plan both cover implants.
Awesome. Thanks for the confirmation, Rosie.
Yep, you're welcome. Sorry about that.
No problem.
And I think that covered that next question, so she's good. Okay, hi Rosie, is deep cleaning covered? I have the base PPO plan.
Yes, deep cleanings are covered under all the plans. Again, you on the Delta Care plan, it's a copay. I'm sorry, it's a set copay, yes.
Okay.
Looking back at the booklet that we were talking about. And
Mhm.
then on the PPO plan, it's a percentage that you would be responsible for.
Great. And then does Delta Dental cover root canal? How much?
So it's difficult for me to say an amount. Root canals are covered. On the Delta Care plan, again, it's a copay, so you could look at the list and see what the amount is that is your out-of-pocket cost. On the PPO plans, it's going to be a percentage depending on the plan that you're on. And again, you can use the cost estimator tool if you're on the PPO plans, and the cost estimator tool will help you to see what your out-of-pocket cost is going to be. Because I don't have a number that I can give you, $150. But if you, on the PPO plan, but if you use the cost estimator tool, that will give you an estimate of what your out-of-pocket cost will be.
Okay. This one is asking, does Delta Dental cover root canals? And how much?
Is that the same question that we just had?
That one was, maybe I'm confused. Yes, sorry.
No, that's okay. That's okay.
It's a lot.
Okay.
Are crowns covered under PPO plan?
Yes, crowns are covered.
Okay. Is general anesthesia covered by the PPO plan?
General anesthesia is covered depending on the procedures you're having done. If you're having oral surgery procedures, general anesthesia is covered. It's called deep sedation. But it depends on the procedure that you're having done. So if you're having a cleaning, you cannot have deep sedation with a cleaning. It has to be with a code that is related to oral surgery.
Okay. And then, okay. Did she say in the base PPO, we are responsible for 70% of the costs and major services?
Yes, after the deductible.
Okay. And then it says, where can we find the sheet with the list of costs? I have your information as well. I will send it directly to you so you know exactly where to find it and refer if needed. Flona. Okay. This one. All right, hello. I have periodontal maintenance cleanings and I go every 4 months. Each year I am paying for one of those visits, but regular cleanings I could go 4 times a year and they would be covered. Why is that? Does that not sound normal?
I would have to look into that one. If you could take their information so that I can check on it and get back to you.
Sure.
That doesn't sound right, but I would have to confirm.
Okay. I have your information, Ms. Robbins, and I will follow up after the call. Is there coverage or a reduced fee for a bone graft in the buy-up PPO plan?
So bone grafts are covered depending on the services again, if it is to save a natural tooth, it is covered. If it is in conjunction with an extraction or an implant, then it's not covered. In a case like that where you want to know, on more specific treatment plan, we also have the ability for your provider to submit a pre-treatment estimate to us. And all that is a claim form without a date of service, so that we know you haven't had the work done yet. You're just looking to find out what your exact out-of-pocket cost is going to be. They can submit that to us, and then we'll process that and send the information to your provider and to you, letting you know what your out-of-pocket cost is. With something that specific, I would definitely do that, so that you could have a good understanding of what your out-of-pocket cost is going to be and what's covered and not covered in the plan.
Okay. All right. Oh, right when I think I'm good, let me see. Oh, no, she says, thank you very much. I believe that is all that I have for questions right now.
Okay,
Alrighty.
sounds good. So we'll move on then to some member support. And again, Latrice, we'll have some time at the end, because I only have a
Sure.
slide. So if the questions keep coming, no problem at all. That's good, right?
Sure, yes.
We want questions to be asked because we certainly want you to have a good understanding of your plans. And again, we encourage you to use your benefits. So this is very good.
Perfect.
So the first thing, I want to encourage you, if you have not already, to create an account on our website, deltadentalinS.com. There's a lot of valuable information for you there. If you're on the PPO plan, you can look at your claims. On either plan, you have access to your ID cards, to your benefit information. And again, the list of co-pays that Latrice will be sending to a couple of the people on the call that have asked is also available here. So you always have access to that, so that you can find the information of your coverage. We also have a mobile app that is very convenient and handy. So I wanted to just let you know that we do have a mobile app available. If you scan on this QR code from your phone, it takes you right to the App Store where you can download that. And then I did want to spend some time on the member perks. A lot of times our members forget that aside from your dental benefits, you also have some additional perks, discount programs, etc., that come with your benefits that can be very helpful and help you save again on out-of-pocket costs on other things. So I wanted to review that with you. The first one is virtual dentistry. We do have 2 tools available for virtual dentistry. If you are afraid of going to the dentist, maybe know someone who hasn't been to the dentist because they are afraid of the dentist, this could be, a good solution for them to at least get some information on their dental health. Also, if you find yourself in an emergency situation where you're in a lot of pain and you're not able to get into your own dentist right away, you can set up a virtual call with one of our dentists, and as they determine, they can send you antibiotics for pain relief until you are able to get into your dentist. So that can be very helpful as well. We do have programs for discounts on hearing aids and LASIK surgery. So we've partnered with Amplifon for the hearing aid discounts and QualSight for the discounts on LASIK surgery. So if that is something that you or someone in your household is interested in, you might want to check that out. Life Perks is a discount program on many different products, not just on oral health products, but many other services as well. It's again a membership where you just sign in and you get an email each month giving you information on that. There are discounts on travel, on gym memberships, on different kind of electronic products. So again, I encourage you to check that out if that's something that you think you might be interested in. We have a lot of wellness resources on our website as well for you. But one that I want to highlight a little bit more is the healthcare spending card. So with this healthcare spending card, if you've been to the dentist or to any other doctor, even to the vet, and you've seen there's a card that they have that's called a Care Credit. where they can, you can put it on this credit card. It's sort of similar to that, but not exactly the same. So with our healthcare spending card, we've partnered with Lane Health, and they provide you a line of credit where you have this line of credit available to you to use for healthcare needs. Anything that you have that is dental health related as a Delta Dental member, you will not have any interest over 12 months. So if you access the card and you had to come out of pocket, say $500, they will break that $500 over 12 months, and you have equal payments over 12 months until you've paid the $500. They do not check your credit, so it does not affect your credit. You just have to give some information of who your employer is, how long you've been there, and they will give you a line of credit accordingly. And then again, any dental related procedures that you have can be financed with zero financing over 12 months. So very convenient if you're looking to have work done. It's a lot of work and you're going to have to come out of pocket for a lot of it, or for a large amount. We know that dental expenses can be quite high. You can use this card again and spread that cost over 12 months if that's something you think will be helpful for you. I was going to ask if there were any questions on any of these programs before I move forward.
I
And
don't think there are any on those programs.
just to mention real quick, thank you, Latrice. With this QR code or this website here, will take you to the landing page where all of these different perks are available, that you can, do further research, look into them, or sign up for the healthcare spending card if that's something you're interested in. You can either go to this website that is listed here, or if you go through the QR code, it will also take you to that landing page on your phone. Okay. I will move on then to just some additional information for you on some oral health webinars that we hold throughout the year. They are hosted by some of our in-network dentists. I'm sorry, not in-network, in-house dentists that work here with us at Delta Dental. Very, very good feedback that we have received on these webinars. Very good information. I highly encourage you to sign up for one if it's something you think you might be interested in. They happen different times of the day. So you would elect the one that you're interested in and register. And then once you register, they'll send you additional information. But again, it's a live dentist giving you information, very helpful information. We've gotten great feedback, interactive. You can ask questions as well if there's time at the end. So I wanted to share that with you if it's something that you think you might be interested in, so you can go ahead and sign up for those. And the last slide here is just our contact information, our customer service phone numbers. Again, the website is deltadentalins.com. So I wanted to leave you with that information in case it's something where you have a question that you need to speak to someone to ask. But that was the end of my presentation. So I wanted to ask if there were any additional questions that you might have.
I do have a few. If you could go back to the phone number for Delta.
Sure.
Again, if you have questions regarding your dental benefits, we encourage you to contact Delta to get the information that you need with regard to costs, or if you have upcoming procedures and you have any questions prior to going to the dental office. In addition to that, I do have a question. It says, she was asking, are retainers covered with Invisalign treatments?
So with the Invisalign treatment, the treatment normally is the retainer. It's a treatment that is retainer based. If you are on the PPO plan, you can use the orthodontic and lifetime maximum towards Invisalign. So you can use the Invisalign, but I want to say that the last retainer that they give you is the retainer that you keep. So yes, it is part of the treatment plan. Again, with orthodontics, the retainer is included within the treatment plan itself.
And this is saying, what are the steps or the procedures that they would need to take if they have a question on an estimate The dentist says that the Delta insurance wasn't covering the procedure, but I see in my benefits doc that the insurance does cover a portion. So who would I speak to ensure or to get more information on why my dentist isn't saying so?
So if you're on the PPO plan, I would encourage you to have your dentist submit a pre-treatment estimate. You'd be surprised how many times a dentist will say, oh, you know, I didn't include this in the claim because it wasn't covered. But then when they send us the claim, it is covered. So I would encourage them, any procedure that you're having done, include in that pre-treatment estimate request. And again, a pre-treatment estimate on the PPO plan specifically is a claim form without a date of service. So it's the same claim form that they would normally send in, except it does not have a date of service. And then that way we will process that and get back to you and to your provider, showing exactly what's covered and what's not covered on your plan. That's the best way to do it.
Where do we find life perks?
I'll go back to, here we go. So you can go either click on this QR code or go to this site here, and it'll take you to the landing page where all of these are listed.
Are any whitenings covered on any of the Delta dental plans?
I believe on the PPO plans, the whitening is not covered. I believe on the Delta Care plan, the whitening trays are covered at a copay.
Oh, there must be a problem. It says the Delta Dental website says we're experiencing an internal server problem.
Okay.
They were just trying to look up life perks, so perhaps.
Yeah, I'll go ahead and report that. I'll go ahead and report that. You can also try the QR code.
And we will send out a notice once we get some information back that has been corrected. All right, we are actually 4 minutes over the scheduled time, but if you have any additional questions, we'd be happy to take them right now. Is there anyone that has any last minutes that they'd like to get answered? I'm getting a ton of thank you, Rosies.
Oh, thank you for joining again.
Thank you everyone who did take the opportunity to join today. Anyone who did join the webinar, we will send your information automatically for your benefits credit for attending this webinar. We thank you so much for just inquiring and being involved and trying to contribute to your overall wellness. So thanks everybody for joining us.
Thank you.
And thank you, Rosie. Hold on.
Absolutely. Thank you for having us.
Yes, everybody have a great day.